Hello everyone, good evening everybody. I'm Priyanjali from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today we are going to discuss a very important topic which is myths in urology. Urological health is essential for both men and women. But there are many myths and misconceptions that can lead to confusion or unnecessary anxiety. Understanding the truth behind these myths can help you make better decisions about your health. To throw more light on the subject and guide us on what's right and on the myths of urology, today we have with us renowned urologist Dr. Varun Rajan, MS General Surgery, D.N.B. Urology, consultant urologist. He's currently practicing at One Care Medical Center at Karpagam Medical College Hospital, Coimbatore. Over to you, sir. We would like to welcome you to today's platform. And the first question for you would be: many people believe that the clear urine indicates proper hydration. Could you explain why pale yellow urine is actually considered ideal and what clear urine might suggest about a person's hydration level?
Good evening, everyone. So, to answer your question, clear urine actually denotes overhydration.
Right.
The
Uh,
normal color of urine is straw yellow. So, when
right.
people drink enormous quantities of water, urine may alter its color to a pale to a clear colored urine.
Right.
Dehydration, on the on the other hand, may lead to a high colored urine. So, when you actually drink more water, that leads to a dilution of essential minerals and electrolytes in your serum, in your body, actually. So, when that
Okay.
happens, you can actually uh, excrete enormous quantities of urine and you may feel tired.
Right. Right. So we are saying here to watch out on our urine and the color of our urine to make sure how much water we actually need to intake.
Yes. See, generally we say the normal volume of urine that a person should excrete is around 1.5 liters per day.
Mm-hmm.
This volume will vary according to the age, according to the season, and according to the
Mm-hmm.
problem which the person has. For example, if the patient has some a heart condition like heart failure, or if he has a kidney problem, he may not be able to excrete that much amount of urine. It may come down to 500 ml or 100 ml. Some cases even nil urine output. So in those cases, the doctor will advise you not to drink too much water. There will be water restriction. So you have to be mindful of that particular issue over there. On the
Right.
other hand,
Uh,
high colored urine,
yes.
which can be a sign of dehydration,
Mm-hmm.
when you do an intense workout, when you work in the hot sun for quite a long period of time, the color of the urine may change from straw yellow to an orange tinge. Many people come to us saying that we find blood in urine. Actually, it's not blood. It is an orange tinge. It's due to dehydration, and we get further history from them. We come to know that they have actually uh, worked out in the gym.
Right. So what are the other issues, other health issues which can occur due to less hydration or dehydration, as you said?
One thing is, if you if you don't drink enough quantities of water, you will feel
Mm-hmm.
tired,
Right.
lethargy. You may be prone to get kidney stones. Though
Mm-hmm.
dehydration is not the only reason to get kidney stones, there are other factors which also weigh in on the cause for kidney stones. But one of the main reasons why people do get kidney stones is when they don't drink enough quantities of water. The
Mm-hmm.
kidneys need adequate water and fluid volume, to have a good blood flow. If you don't give those quantities of water to the kidneys, they're not going to function well.
Right.
So these are certain problems that you might encounter.
Right.
Dehydration can actually lead to a reduction in the kidney function.
Right. What about UTI, doctor? Can dehydration be the reason behind it as well?
Yes, yes, UTI, but of course, urinary tract infections can be precipitated by poor water intake,
Mm-hmm.
right? But that's not the only reason for urinary tract infection. You can have poor genital hygiene, abnormalities in the urinary tract,
Right.
postmenopausal women. So many
Right.
reasons are there.
Right. Right. Now moving ahead towards the next question, doctor. It's
Yes, ma'am.
common for people to think that waking up at night to urinate always signals an underlying health problem. Can you clarify when nighttime urination might be considered normal and when it might be a signal of something more serious?
See, uh, there's something called nocturia, which we define in medical parlance as
Right.
getting up more than 2 times at night to pass urine. So the
Mm-hmm.
criteria is if you wake up twice at night to pass urine, that's actually considered normal. If you fall in the age group of more than 50, say if you are an elderly person, your urine production at night may be actually increased, maybe more, which might be normal. Okay, that's called nocturnal urine overproduction. On the other hand, this may be considered abnormal if you wake up more than 2 times at night to pass urine. Say if you wake up at 1 a.m. in the morning, you go to the restroom, you pass urine, come back, sleep again at 1:30, go back to the restroom, pass urine, come back, sleep. 2:30 you wake up. This cycle keeps on continuing till 3, 4, 5, 5 a.m. So this is abnormal. Suppose you wake up at 1 a.m., you pass urine, come back, sleep, have a good rest till 5 a.m. and then you go and pass urine again and then you're comfortable till 7 a.m. and you wake up at 7:30. This is considered normal.
Now, for the people who have had this question in mind, I think it is clear after this answer. Doctor, the next question is there is a widespread belief that urinary tract infection, just we were talking about it, are only
Yeah.
caused by poor hygiene. Can you elaborate on the various factors that can contribute to a UTI and why this myth is misleading?
Yes. See, urinary tract infection can occur irrespective of age groups and irrespective of genders, right? It
Hmm.
is not that only females get UTI. Even males get UTI. Children do get UTI. So one
Right.
of the main reasons is dehydration. You don't drink enough water. So the excretion of urine is little. All the bacteria, they have to get washed out in urine, which doesn't happen. Second is poor genital hygiene. Okay. One particular thing which patients keep on asking is, I am using a restroom in my office. It's a public restroom. Many people
Mm-hmm.
use it, and I get UTI often. Is that a reason
Mm-hmm.
for my UTI? Well, the answer is yes and no. Okay, there's no clear cut answer to that. Studies are still on to say to find out whether that could be one reason. But generally, the issue here is if you're going to the a public restroom, it's better that you take utmost care not to take care of your own personal genital hygiene when you use the restroom. Maybe wash the closet a bit before you pass, and after you pass urine, you wash it a bit and then pass. That's one way where you can avoid urinary tract infections. One more reason is if you have some abnormalities in the urine tract, say, for example, an elderly man may have a prostate enlargement. That could actually result in some stasis of urine after he passes urine. So, in prostate enlargement, what happens is the urine doesn't get emptied completely. Some urine stays back inside the bladder after he passes urine. So, that stagnant urine acts as a nidus for infection. and bacteria multiply in that urine. So an abnormality like a prostate enlargement can cause urinary tract infection in a male. Any block in the urinary passage can cause urinary tract infection in the male. Stones can cause urinary tract infections in males or females, whatever. Children who have conditions like vesicoureteric reflux or posterurethral valve, I'm not going to go into the depth of these conditions. It's a different ball game altogether. But these conditions do predispose to urinary tract infections in children. When we come to
Mm-hmm.
females, we know that they are more prone for urinary tract infections. The primary reason being their urinary passage, we call the urethra. Okay, the urethra is shorter in females. The male urethra is approximately 20 centimeter long. The female urethra
Mm-hmm.
is around 4 centimeter, approximately. Okay, it can vary 1 or 2 centimeter here and there. Now,
Mm-hmm.
when the urethra is short, it facilitates easy passage of bacteria to pass from the urethra to the kidney. So we find that infections in urinary tract infections in females can easily flare up and go to the kidneys, okay, by the backflow. So and postmenopausal women who are more than 50 or 45 years who have completed their menstruation are more prone for urinary tract infections. The prime reason being they have hormone deficiency. Estrogen is the female hormone, and that gets deficient in the postmenopausal age group. When that gets deficient, the urethral passage, the urinary passage, the lining of the urinary passage gets dried up. Okay, and that results in uh, some ulcerations. That results in a narrowing, a slight bit of narrowing, and that can cause an infection.
Right. Now, uh, identifying the condition becomes a little tough for us when we are talking about any sort of disease. Identifying this
Yes.
disease becomes a challenge. So, what is the initial stage like? How does one know that this is UTI and this is the right time to visit a urologist and get it treated?
Yeah. See, these patients will present with burning sensation while passing urine, right? That would be
Right.
the first symptom that they may have.
Mm-hmm.
What happens many times, uh, they don't report to the doctor actually.
Hmm.
What they do is they speak to their colleagues in the office or their family members. They say, I have got little burning sensation. They will say, the relatives will say, okay, drink more water, it will subside. Now, what these people do, they drink more water and lo behold, it subsides. But then the primary cause is not addressed here.
Hmm.
The infection may still be
So,
persisting inside. That leads to flaring up of the symptoms. They land up to the clinician with fever and sometimes lower abdominal pain or pain in the flanks. So when a flare up of this infection occurs, it becomes imperative to treat it with utmost care.
hmm.
And that is when
Right.
the doctor pitches in. But what I
Right.
would suggest is you got to report in the early stage itself. When you have burning
Hmm.
sensation while passing urine, that could be an indicator of a urinary tract infection, but that is not the only indicator for urinary tract infection. Many times, burning sensation while passing urine is treated as urinary tract infection, but there are other conditions which can also cause this burning sensation. One among them is a stone. Now, we have heard of kidney
Hmm.
stones. Now, the
Right.
kidney excretes urine through a small tube which connects the kidney to the urinary bladder. That tube is called the ureter. Now, the stone can actually pass down the ureter and give rise to symptoms which mimic a urinary tract infection, which resemble a urinary tract infection. So the patient might come with a burning sensation while passing urine or a vague lower abdominal pain or sometimes even blood in urine. So this is one possibility. Excluding a urinary tract infection is one thing, but including other causes is another thing. So stone could be one reason for your burning sensation. The other reason could be that you are not hydrated properly as people actually think. Uh, you need to drink more water. That is one thing. Passing acidic urine, passing concentrated urine is one more reason.
Mm-hmm.
There have been cases where the only symptom has been a burning sensation. Patient has undergone an ultrasound and been found to have cancer. I'm not creating an ominous situation here,
Mm.
but when you
Right,
have a
right.
burning sensation, please do check with your doctor whether
Mm.
this could be something simple or something sinister.
Right, right. Now moving ahead, doctor, tell us, is this contagious? Is it possible that it can spread from one person to the other?
No, ma'am, not at all. Urinary tract infection is generally not contagious. But again, there are people who come and ask, I mean, those who are in the middle-aged group, and they say that I recently had a sexual intercourse with my wife and I got the infection from her. So can I
Mm.
continue? So again, my what we generally advise is you please avoid getting into contact till the infection gets over. But again, we
Right,
need more studies and more research to dwell on this particular aspect.
right. Doctor, what are the things that can give us a relief from the condition? Having a lot of water, as you have already mentioned, hydration is one of them. What are the others?
Maintaining good personal hygiene is one important thing,
Mm.
right? Check up with your doctor the moment you have these symptoms,
Any food
right?
habits?
Food habits. Uh, I mean, people have found that cranberry juice
Right.
has been found to have a good effect. Cranberry
Mm.
juice, but again, we need more research on this aspect actually.
Right. Right. So we are saying that water is one of the best thing that, and maintaining your personal hygiene are the best
Yeah.
thing that you can do to yourself in order to get rid
Yes.
of it. And of course, visit your nearest expert as soon as possible. Now, doctor,
Yes,
let's
ma'am.
move on to the next question. Many individuals
Yes.
assume that all prostate issues show clear symptoms. How can conditions like benign prostatic hyperplasia or BPH or prostate cancer be asymptomatic? And why is early screening important even if no symptoms are present?
See, this benign prostatic hyperplasia is a disease of old age. Okay. Invariably, if
Mm.
you're more than 50 years of age, you will almost have an enlargement of the prostate. Okay. There's no going back on that front. But then, not everyone requires a treatment and not everyone develops a symptom, right?
Right.
Many of them are asymptomatic. I mean, without symptoms, they go for a master health checkup. The ultrasound detects a prostate enlargement and they come to the urologist saying that I have got a prostate enlargement. Do I need treatment? So, those cases, when we receive those kind of patients, we actually go a bit deeper into the history. We ask them all the basic symptoms like how often are you passing urine at night? How is the flow of urine? Is it normal or is it slow? Mm? And then do you have burning sensation? And do you have urgency and extreme urge to pass urine? And do you actually lose control of urination? So all these are all symptoms that we ask them when they come. Now, if the answer to these questions is no, then
Mm.
we might as well just leave them. Okay, we tell them no need to worry. This is a normal enlargement. You don't have to rack your brains regarding this. Just
Mm.
sit tight. Come back to us when you have a problem. But then there's another subset of patients who come with these symptoms, and they will need some kind of intervention in the form of medical therapy or surgical therapy.
Right. Uh, so, doctor, now speaking of the surgeries, which you have already mentioned, um,
Yes.
the surgical procedure or the medicines for the same kind, uh, what about diabetic patients? Can it look a little different for the patients? Can it be a little tough for them to, get over the condition?
See, diabetes is a big, what do you say, a block in many a treatment.
Hmm.
Reason being, diabetes can lead to a misdiagnosis of many urological problems. Diabetes can cause something called polyuria. Polyuria is again passing more quantities of urine. So in diabetes, patients will experience frequency. Okay. So sometimes patients think that passing more urine is a sign of diabetes, and they don't report to the doctor when they actually have a prostate enlargement, and that prostate enlargement could be one reason which is causing this particular polyuria, right? So that way, diabetes can impact the uh, symptoms and can make it difficult for the doctor to actually initially diagnose. Second thing is, any procedure for that matter, if you're doing any procedure for the prostate or any surgical procedure, diabetics, unless you are a well controlled diabetic, there's always a chance for an infection. Any open surgical
Hmm.
procedure, any endoscopic procedure, whatever you do, okay, unless you're well controlled, the chances of infection are high. That they're not zero. You can get an infection, but the chances of you getting an infection are quite less when you are a well controlled diabetic than what would happen if you are an uncontrolled or a poorly controlled diabetic. So diabetes will have a major influence on urological conditions in the diagnosis as well as the treatment.
Right. Moving ahead, doctor, towards the next question is, uh, well, there are some myths that sexual activity can affect the risk of prostate cancer. So, can you explain why activity has not been shown to influence prostate cancer risk, and what factors are actually more important in determining risk?
This is actually a hot debatable topic in many conferences and in many research scenarios and journals, whether
Right.
sexual activity prevents and reduces the risk of prostate cancer.
Mm-hmm.
Many proponents say yes, many opponents say no. So, prostate cancer basically is more of a hormone sensitive hormonal problem. It can also be a genetic problem. So, if we got a family history of prostate cancer, then you should be on high alert once you cross the age of 40. There are many health checkups which add a particular a blood test is called serum PSA estimation. PSA stands for prostate specific antigen estimation. Okay, it is completely non-invasive where I mean I mean two ways to detect prostate cancer. One is you stick it's something called digital rectal examination where the doctor actually examines the prostate through the rectum where you can detect a prostate cancer. Or if you are doing a screening, you can do a serum for prostate specific antigen. So men who are above 40 and who have a family history of prostate cancer, it would be better if you can go for a screening early, maybe around 40 to 45, so that you come to know of your risk, the risk of getting a prostate cancer. But then that doesn't create alarm bells over here. You might still end up not having a prostate cancer in your lifetime, but if you have had a family history, it's well and good that you go for a screening checkup at least once a year to see whether you you have a risk of getting prostate cancer. It's something like breast cancer in females. And though in breast cancer we have this BRCA gene mutation, so breast self-examination, everything is advocated at an early age. But in prostate cancer, the only tool which is available to us is the serum prostate specific antigen, which may again be normal. Okay, which may again be normal and may not show you that it is indicative of prostate cancer. But then it's better that you report to your clinician and you tell them that your family in your family someone, either your sibling or your uh, some elderly person had a prostate cancer and I want to do a screening test for this, and your doctor will advise accordingly.
Doctor, also people often believe that kidney pain, which can be on the lower back sides, automatically means kidney stones. What are some other potential causes of kidney pain, and what is it important? Why is it important to get a proper diagnosis?
Yes. See, this is a perplexing situation many a time in the clinical OPD setup. We get referrals from the orthopedic department. The patient reports to them with low backache, and they find that there is no orthopedic pathology there, and they send the patient to the urology department saying it could be a kidney stone. And when we actually do the ultrasound scan, and we find that there is a kidney stone, but then small stones inside the kidney. Okay, I'm talking of stones which reside inside the kidney. I'm not talking of stones which come down the kidney. I told you earlier that stones descend down the kidney from the kidney to into a small tube called the ureter. Okay, I'm not talking of those stones. I'm talking of stones which are inside the kidney. So those small stones which are inside the kidney will generally not cause pain. Okay, the kidney pain which we are talking about is a flank pain. Okay, the it's a lateralized pain somewhere here in the on the right flank or on the left flank, which might be a dull aching pain. That may not be actually due to a stone due to kidney stone. It might be due to a lumbocostal nerve irritation. I mean, you have muscles, you have soft tissues, you have bones, you have joints. Any inflammation or any pathological process there can cause a pain over there. So that may not be the reason for. I mean, that the kidney stone may not be the reason for the pain over there. But then there are certain conditions which can cause pain in that particular site, especially if you have a stone coming down the kidney into the ureter, or the stone causes an obstruction to the passage of urine from the kidney to the ureter, which causes an enlargement of the kidney, and that can cause a pain over there. Or maybe you had a trauma in that area, which involved the soft tissues and maybe even involved the kidney, you can have a pain over there. But when you have a trauma, it is usually acute. I mean, you get an acute kind of pain. I mean, it is severe pain, right? The pain which generally patients report to us is a dull aching pain. It is not that severe. So many a time, and that's the kidney stone is not the reason for the pain in the flanks, unless and until we find a stone which comes down into the ureter. So
Right.
whatever we do,
Also,
we almost end up counseling the patient, saying that this could not be the reason for your pain. And again, we shift him back to the ortho department, and they do further tests regarding the spine. Spine pathologies can cause pain in the flanks. Okay, any degenerative disease in the spine or any fracture, old fractures, can cause nerve irritations by compression of the spinal cord. You have the spinal cord and spinal canal. Compression over there can cause flank pain. So always flank pain need not be due to the kidneys.
right. Doctor, also there is a myth related to kidney stones that drinking a lot of beer can somehow wash away the stones. So, is it true?
Basically, I'm a teetotaler, so I would say no, right? So
Right.
beer doesn't have any role to play. In fact, some studies have shown that beer can actually cause kidney stones. So
Hmm.
I would strongly advise, don't take alcohol, say no to alcohol, say no to smoking. So
Right.
it's someone's take on
So,
that. Yeah,
are we also saying that smoking can also make the condition worse?
not no no. I just added that's all. Smoking doesn't have a role
Right.
to play here, but smoking can cause bladder cancer.
Hmm.
Just like smoking can cause lung cancer, smoking can cause bladder cancer. So those who are smokers, you have to be on the watch out.
Right. So, if so, doctor, what is the best way to prevent ourselves from having kidney stones?
Yeah, best way is drink plenty of water. Keep your kidney, your renal blood flow. I mean, you should have a good renal blood flow. That will cause a good amount of urine output, and that will result in most of these stone forming substances to get washed out in urine. But then again, drinking plenty of water alone will not suffice. You all the time you can't be just drinking water. You can
Right.
drink tender coconut water. You can drink
Mm,
buttermilk, fresh fruit juices. But again, if you drink aerated drinks and all those things, it may not gel with you. Then cut down on your tomatoes intake. Cut down on your non-vegetarian food. I'm not saying stop it. Just reduce all your meat intake, because all this can cause certain substances to get excreted in urine and we all have read in chemistry something like called saturation, supersaturation of crystals. So the same phenomenon occurs in the formation of the kidney stones inside the kidney also. So when you have an overproduction of a substance or a reduced excretion, washout of the substance, that can cause a kidney stone. So to prevent an overproduction, it's better you cut down on certain foods and you drink plenty of water and fluids, basically fluids. Clear fluids would be better. And
very
if
well.
you have
Doctor,
already have had a kidney stone, you need
mm-hmm.
to have a good follow-up checkup on that.
Right, right, right. So about this also, we have heard that once a kidney stone patient, always a kidney stone patient. So there is always a tendency that you might get it back. So as mentioned by doctor already, you need to keep a proper check on your health, your diet, and your hydration, of course.
Exactly. Uh, One point I would like to mention here:
Yes,
we
please.
see patients who get kidney stones. I mean, stones in the ureter, and there are
Mm-hmm.
certain cases where we treat them with medications. Okay, there are certain medications which allow the passage of stone down from the ureter into the bladder and facilitate easy expulsion of the stones. Now, what happens is sometimes patients uh, don't pass out the stone actually, but the pain gets reduced. They are totally
Mm-hmm.
symptom free. They become symptom free after a course of treatment for maybe a week. The issue here is they don't report back to the doctor. They think that the stone has dissolved. Okay, stones don't dissolve. Basically, you drink 1,000 liters of water, you're not going to dissolve the stone, right? Stone, the stone will pass out on its own, or it won't pass
Mm-hmm.
out. That's a basic thing about it. Okay, you cannot wash out a stone, right?
Right.
And the stone will not get dissolved no matter whatever you do. They go to this
Mm-hmm.
native treatment. So many therapies are available, local therapies, native therapies, but then a stone will not get dissolved. A stone has to pass out on its own. There are there might be certain conditions where the stone might not have passed out, but he may not have pain. Now, always when you have pain, that is the main thing which will bring you to the doctor. If you don't have pain, you will not come back to the doctor. But if you've already had a stone in the ureter and a doctor has given you medication for it, and now you don't have the pain, that doesn't mean you don't have the stone yet. The stone is could still be there inside the ureter. So you need to report back to the doctor, because the doctor would have given you a date for the follow-up. Come back to the doctor and tell him that I don't have pain now, but I want to be doubly sure whether the stone has actually come down. And then what your doctor will do is he will prescribe and repeat a check ultrasound scan, and he will see whether the stone is there or not. And then once the stone has gone out, you come to know that the stone has been excreted. Then you're well and good. Does not get the stone is still remaining inside your ureter, then he will suggest you further treatment.
Right.
So follow up is
Now,
essential.
right, absolutely. Doctor, there is also a myth that only elderly men need to worry about prostate health. Could you explain why prostate health should be monitored at all ages and when men should start paying closer attention to their prostate?
Yeah. Actually, we already addressed this. I told you
Yes.
that a person aged more than 40 who had a family history of prostate cancer
Mm-hmm.
should be on high alert that he could develop symptoms or signs of prostate cancer later on. So we should maybe go for health checkups, maybe once a year or once in 2 years, just to see whether he gets a risk of prostate cancer. Then again,
Right.
prostate as such may not be there are other prostatic conditions which can also cause problems with men of all age groups, not just benign prostatic enlargement. It can be prostatitis. There's something called prostatitis, and this is a big headache for the patient as well as the doctor. Patients who come with prostatitis, they come not just with symptoms pertaining to prostate, but they also have a dull aching pain in the pelvis. They have discomfort, continuous long-term discomfort, and the so many therapies have been proposed, so many therapies have been tried. We still are in the research area to see which therapy could actually benefit these patients. So, prostatitis, benign prostatic enlargement, and prostate cancer are three entities which can affect males. As far as the prostate is concerned, prostatitis can occur across all age groups. Benign prostatic hyperplasia or benign prostatic enlargement is a disease of old age. Prostate cancer again can occur across age groups. So uh, everyone needs to be in. If you're more than 40 years, better to check with your doctor whether you have something pertaining to the prostate. That's all.
Right. The next question, doctor, is about infertility. We have heard that infertility is often thought to be mainly a female issue. Can you discuss the role of male factors in infertility and why both partners should undergo testing when experiencing difficulty conceiving?
Yeah, this is not only a medical problem. This is a social problem.
Hmm.
Infertility rates are actually rising in India. You see,
Right.
many villages, especially, women are being blamed for this infertility. Now, let me tell you that in infertility, 50% is due to the male factor, and many times we end up treating both the male and the female partner. Now, infertility doesn't just stem from the female side. The female could be having a polycystic ovarian disease or any other condition which leads to infertility. But then, as far as the males are concerned, many of them don't report due to with conditions like erectile dysfunction. There could be actually a sexual problem affecting both the couple. So this
Hmm.
is something of a taboo when they don't come forward to the doctor. They don't come to the doctor with this particular problem. Okay, so erectile dysfunction is one area, which is one problem. Ejaculation problems is another one. Then you have
Hmm.
poor sperm counts, reduced sperm counts. Now, again, this is a lifestyle problem. We find that people who are almost stressed day in and day out, they have low sperm counts. Those who are smokers, those who are alcoholics, they have low sperm counts. Those who work in um, what do you say, hot areas, hot climates, those whose jobs are very stressful, they have low sperm counts. Those who don't sleep well, they have low sperm counts. Those who have hormonal issues, I'm talking of men actually, okay, they have low
Hmm.
sperm count. There may be some problems in the genital tract, small volume testis, some conditions which are called varicoceles. Okay, varicocele is a condition where the veins in the
Right.
testis, putting it in plain language, veins in the testis get enlarged, and
Right.
that reduces the sperm count. So all these are
Hmm.
issues which can affect the male, and many times we find that the females go taken first to the gynecologist, and the gynecologist then sends the male to the urologist or the general practitioner to find out the cause for male infertility. But then it is almost many times it's reluctance on the part of the male to come to the urologist to have a checkup, and the blame is solely put on the female. So it's become kind of a social problem. But now people are becoming more aware of this problem, and it's a healthy sign that the couple as a whole is coming to the
Hmm.
doctor, discussing their issue threadbare, and coming to a solution with this infertility. And many are actually doing good. I mean, they conceive.
Right.
So we have to identify the problem and then work out the customized treatment for them.
Right. Doctor, we have a question coming up from a viewer who asks, can
Yes,
holding in urine for too long cause permanent damage?
it can cause urinary tract infection because I told you, stasis of urine, stagnant urine can cause a growth of bacteria. So
Right.
that can actually do you no good when you uh, hold up urine for long period of time. And if you are habituated to holding up urine for long periods of time, what happens is the you're holding up urine inside your bladder, right? So the bladder is kind of is an elastic structure. It will kind of accommodate the extra amount of urine. But beyond a certain point, okay, beyond a certain point, the bladder will say, no, okay, enough is enough. Now I have to do something to
Mm.
get rid of this urine. So there will be some changes within the bladder, and these changes will in fact be reflected back on the kidneys. So you can go in for some kind of renal damage if you are habituated to this particular problem. If you don't
Right.
pass urine and if you hold up urine for long periods of time, you may actually end up having some renal damage in the long term. I'm not saying in the short term, in the long term. And this can predispose to urinary tract infections, and this infection can actually reach the kidneys and so on and so forth.
Doctor, well, we had a wonderful discussion on the topic today about all the myths in urology. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah. So one thing which I would like to emphasize here is when you report to your urologist or any primary care physician with respect to a urinary problem, please tell him whether you had this problem earlier or this is the first time you're having this problem. That's point number one. Point number two is if he diagnoses the condition, it is good that you go for a checkup or a follow up. Follow his advice. Many times we find that the follow up is not proper. The follow up not being proper, patients come back with severe complications later on. For example, if we treat cases of benign prostatic enlargement day in and day out. Now, these cases of benign prostatic enlargement, not all of them require surgical management. Many of them are
Mm,
managed with medical therapy.
mm,
What happens is they don't take these medications on a daily basis. Okay, they have to take these medications on a daily basis. Something like diabetes and hypertension, where you take medicines on a daily basis. They
right.
take it for some time, then they feel that okay, my symptoms have improved, so I'm good to go. So let me stop these medications. And once they stop it, the whole process starts coming back again over a period of 2 months or 3 months, and they come back with the same problem. And sometimes they don't actually come back earlier, they come back very late, and that is the point of time when they develop bladder stones, okay, stones within the bladder, which will require surgery. Or and certain conditions where I told you, no, you hold up long large volumes of urine over longer periods of time, it can cause renal kidney damage. So these are conditions where, due to the poor follow-up of these patients, they'll end up in severe complications. And what could have been actually managed medically ends up with the patient being forced to undergo a surgical technique. So follow-up is very essential, and give good importance to personal hygiene. Drink good quantity of water. Don't drink too much of water. Okay, too much of water, drinking 5 liters, 6 liters of water is it's not advisable. Drink enough water so that you excrete at least 1.5 liters of urine per day, especially if you're a normal individual. I'm not talking of those who have heart conditions or already have been diagnosed with kidney problems. Don't hold up urine for long periods of time. Make sure that you attend your checkups regularly. Keep your sugar under control. Cut down on your alcohol. So I think that's it.
Well, that was the expert advice for today. And that was Dr. Varun Rajan for us. Thank you so much, Doctor, for your valuable time. We got to learn a lot from you in today's session. And it was quite an informative session for our viewers today. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you so much. It was a pleasure meeting you all.
Same here. Thank you so much, Doctor.